Dulu okey, tapi yang kanan, kiri lagi kiri kanan. Kiri yang mula-mula tu. Kiri dah cun lah. Boleh kali boleh. Kiri mana kosong kan? Lagi kiri.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. A very good evening and warm welcome I bid to our honorable speaker, Puan Anita binti Abu Bakar, President of Mental Illness Awareness and Support Association, MIASA, Professor Dr. Suzana binti Abdul Rahman, Dean of Kuliah of Allied Health Sciences, Associate Professor Dr. Radia binti Abdul Ghani, Deputy Dean of Student Development and Community Engagement, members of MIASA, and to all brothers and sisters that joined us today for Kahs Mental Health Awareness Project, KMAP talk, Hearing Unheard Voices, Stigma, Discrimination, and Social Inclusion. I am Nadia Nurshifa binti Muhammad Nizam, a second-year student from the Department of Biomedical Science, delighted to be your Master of Ceremony for tonight. Ladies and gentlemen, brothers and sisters, to gain blessings from Allah Subhanahu wa Ta'ala, I would like to invite Brother Muhammad Fitri bin Nurman from the Department of Nutrition Sciences to lead the dua recitation. Please welcome.
Sorry for delay. So, Assalamualaikum warahmatullahi wabarakatuh. So, Al-Fatihah. A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin wa salatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi washabihi ajma'in. Allahumma ighfir lana dhunubana wa liwalidayna warhamna kama rabbana shaghira. Wa jami'il muslimina wal muslimat wal mu'minina wal mu'minat al-ahya'i wa amwat ya arhamar rahimin. Allahumma innaka ta'lamu anna hadhihi al-qulub qad istamat ala mahabbatik wa taqas ala ta'atik wa tawahhadas ala da'atik wa ta'ahad ala nutati syari'atik wa watikil lahum marabitata wa adim muddaha wahdiha subulaha wa amla'ha binurika alladhi la yahwashah suduraha bifaidil imani bik wa jamali tawakkuli alik wa ihya bima'rifatik wa mis'ala syahadat wa mis'ala syahadati fi sabilik innaka liman maula min nasir. Allahumma filana dzunubana wa liwalidayna wa kama rabbana shaghira. Rabbana atina fid hasanah wa fil akhirati hasanah wa qina azabannar. Wa sallallahu ala sayyidina Muhammad wa ala alihi washabihi wasallam. Subhana rabbika rabbil izzati amma yasifun wa salamun alal mursalin walhamdulillahi rabbil alamin.
Amin, amin, ya Rabbal Alameen. Thank you, Brother Fitri, for the beautiful recitation. Now, I would like to invite Brother Anwar bin Muhammad Noor, the Program Manager of Kahs Mental Health Awareness Project, to deliver the opening speech. Please welcome.
Bismillahirrahmanirrahim. So I hope everyone can hear me. Yeah, all right. Thank you very much. Right, first of all, I'm so sorry and our apologies on behalf of the committees and the organizer in IUM because the Zoom that we used before somehow they have some technical issues that we cannot stream on YouTube. So that's why we are having on another platform. So hopefully we can have the audience from YouTube as well, as we have many requests from public to also have this kind of sharing session because we are blessed with the presence of Puan Anita, the president of MIASA, which we very look forward to have into her session tonight. So inshallah, to all the deans, deputy deans from Al Kuliah, and also to our beloved deputy deans of Student Development and Community Engagement, Dr. Radia, Associate Prof. Dr. Radia, and also our Program Advisor, Dr. Wahida, and to all my dear committees who are the big bones of the CAMAP 2021, and to our dearest friends, and to our respected colleagues from MIASA, who are the collaborators in CAMAP throughout the journey of May 2021. And we will be talking, inshallah, about the stigma that surround mental illness and those who experience it, very pervasive and ubiquitous. It doesn't have that common myth promoted by the media and popular culture right now, often, inaccurate and sometimes destructive and can worsen someone's mental health problems. Especially, I think in these times of pressuring, global pressure era, dealing with the COVID-19, I think it's very important for us to acknowledge and recognize the stigma that we have in our culture. And CAMAP has CAMAP, which is the short form for Kahs Mental Health Awareness Project, aim to advocate the importance of raising awareness of mental health issues, and that is why we are being highlighting those elements and objectives in all of our sub programs. We have video contests, writing contests, and thank you very much to Puan Anita, who also one of the judges and help us in determining the victor. I will be sharing soon. Even the video will be shared soon, which bring the message and portrays the real message behind what we can say that the invisible illness that might people are experiencing right now. And even we have the silent tears or the tears behind the doors that we never know that some are struggling. They may be smiling to us, but in deep down inside, they have that scream inside of themselves. So as allies to those with mental illness, CAMAP also bring an important message to portray to your family, to our friends in need that you are not alone. If someone approach us or if someone approach you or notice that our friend may be in need of help, but they are afraid to seek help, we let them know that they are not alone in engaging with this battle. And also Islam teach on how to live in harmony with others. And also, before I end my opening speech, I would just like to send the warmest regards from our program advisor, Dr. Wahida, and I actually representing her for speech tonight. Uh, she also would like to ask, like us to highlight this important verse from Al-Qasas on verse 77. Seek the life to come by means of what God granted you, but do not neglect your rightful share in this world. Do good to others as God has done good to you. Do not seek to spread corruption in the land, for God does not love those who do this. So I would like to also deliver the wish from our program advisor. Congratulations to CAMAP 2021 and also MIASA and everyone who has participated in this event. So I believe there are also few participants of our contest also joining us tonight, whether in Zoom or even in YouTube. And I am honored to be part of it as program manager, leading the team along with other committee members. And I am extremely grateful. We are extremely grateful to Puan Anita and her team also for agreeing to be a part of this program. So many thanks. I think I do not have to lengthen my speech because we are already late. So many thanks to all of us and to all of you, especially the participants. Assalamualaikum warahmatullahi wabarakatuh. Thank you.
Thank you, Brother Anwar, for the words of wisdom. Moving on to the next agenda, before I pass the floor to the speaker, let us get to know a little bit about her. So, Puan Anita binti Abu Bakar is the founder and president of Mental Health Awareness and Support Association, MIASA, a mental health advocacy and peer support group based in Petaling Jaya. Being a peer herself, Puan Anita is an advocate in promoting awareness on mental health. She has conducted various programs and initiated many efforts to educate the public on both the importance of mental health as well as addressing many misconceptions and myths in hopes of reducing the society's stigma and inducing the availability of more support for those who are struggling with psychological symptoms. She also has spoken at many universities, corporations, and government agencies across Malaysia. And during the Movement Control Order MCO in 2020, she has collaborated with various organizations and individuals to conduct live sessions on mental health inclusion, stigma, mental health post-pandemic, and more, with the passion of continuously highlighting the voices of those who have suffered through difficult times. Without further ado, let's welcome Puan Anita binti Abu Bakar to share her thoughts on this topic. Puan Anita, the floor is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh, and a very good evening, everyone. Thank you very, very much, Nadia Nur Shifa as the moderator today. Very good evening to Dr. Radia binti Abdul Ghani, Deputy Dean, Student Development and Community Engagement, Kuliah of Allied Health Sciences, Iium Kuantan, Brother Anwar as the Program Manager, and the whole committee. Congratulations for bringing forth this fantastic program. I would like to congratulate all the entries. I had a really good time actually evaluating all the creative writing. There was only one art and all the videos, so I am looking forward to see who wins tonight. I hope the one that I have in mind will win, but anyhow, keep up the good work. Thank you very much, everyone. So I am going to share my screen and I will begin my presentation. I don't know how much time I have, since we delayed a little bit. Nadia, how much time do I have?
Let me confirm first with the prep tech.
It's fine. Okay, can you guys see my screen? Yes, okay. All right, so tonight's topic would be hearing the unheard voices, stigma, discrimination, and social inclusion. And obviously, when we talk about the unheard voices, this would be the voices of those that are struggling with mental health disorders, and that would be, one of the person would be me. I'm a person with lived experience. I was actually diagnosed about 8 years ago. And through my experience with this condition, Alhamdulillah is the whole and every reason why I formed MIASA. Very, very happy, very, very privileged and humbled to be doing this work, Alhamdulillah. And I really, truly hope that all of you will gain a lot of takeaways, good takeaways from this discussion tonight, inshallah. Obviously, when we talk about, stigma, this is very much what MIASA, what we try to champion, what we try to talk about, because till today it continues to be the biggest barrier to mental health, and it is very much alive and well. So addressing its causes, devastating consequences is not easy, because it requires the rethinking of traditional beliefs, and so far doing this work, it has been an uphill battle. But I see that it is easier amongst youth. I see a lot of youth movements very much trying to engage, amongst the public to talk about this in a huge way. And I also see that it's very much normalized amongst youth as well, especially university students. Before the pandemic hit, we've gone to so many universities across Malaysia, and I see that university students are very open about it. Even when we have physical sessions, people raise up their hands, revealing that they are going through, depression, anxiety, having suicidal thoughts, ideation, self-harming. So very, very happy to see that people are reaching out for the help. They don't feel, ashamed or fear, to be labeled or cave to stigma. Much progress has happened, but more needs to be done. So alhamdulillah for that. Okay, so this is actually one of our campaigns that we did a collaboration with Sime Darby, and also with the Malaysia Mental Health Association. And this was done in 2019. But this is very, very much still relevant, of course. It's going to be relevant for a very long time, very much on stigma. So please do enjoy the video.
Berkena dengan dia. As if we could tell what is wrong about a person from what is right just on sight. As if wrong was just a simple matter of right or left. That if you're right, then you won't be left to wander on your own if it is normal to feel left out and be all alone. That you have to deserve fitting right in. So you keep everything in, because what matters is what's inside of you. The more you keep, the better you think you get. Because people only understand different when it is an accent or a color or a sin. So even when your body is breaking from within, you try to behave the same as everyone else, despite feeling that you're lying through your teeth. Spirits seeping through stitches that grafted their words onto your skin. Man up! Orang lain lagi susah lah. I turned out okay. Get over it. Sikit-sikit pun salah. Don't mind them. They didn't mean it. You don't deserve to live. You wonder what it would be like if they actually meant it. It already felt like they did. Maybe that was why some of us tried giving up. Living was already hard enough because it works a little differently for us than it does everyone else. So we tried to find ways to set our minds to rest, only to discover that dying was harder. Our souls just wouldn't let go, and our minds couldn't tell why. You start wondering what is wrong with your body. Sometimes it feels like the wrong body. Where your heart is an old car doing 180 and every interaction is a traffic collision because every pulse is like an accident about to happen but never really does, feeling like it already did, until crashing is the only way of resting that you can think of. You wonder if your body could last the distance. If it's gonna break because your spirits feel like it already did. Maybe that's why some of us drown ourselves in them, because that's the only way to raise them when you're sinking. Because addiction is the only way you hold on to something. The same way how memories hold on to you. And the regrets, the meds, the silences, the comments on your timeline, their voices. Berkena dengan dia. Hati dia gelap. She looks depressed. He likes to be by himself. Dia kena buat. Dia kena bersyukur. Dia kena ingat Tuhan. Like how they do. Using God's name in vain to say He created everyone the same. Not realizing there is a difference between equality and reality and how that affects your sanity while still having the audacity to treat you differently. This is a matter of the mind. If you don't mind, it doesn't matter. Since they don't mind, we don't matter. It's about time we all do. We're all great minds in the making. Refine our senses, assign our minds to read the signs and learn the symptoms instead of being quick to define. Realize that some minds are more like minds that can be tripped by our lines, turning bodies into battlefields of a war that is lost in the silences. When a heart breaks in a room and there is no one else around, does it make a sound? Stigma is the lock we put outside that room, keeping them in. It is a label that we put on that door saying, leave them, because we were too afraid to listen, to look at ourselves, only to ask too late, what did he mean? When did she say? Why did we see? What did we do? Kena dengan dia. Instead of just asking, apa khabar?
It's still so impactful when I watch it, and I've watched it hundreds of times. Alhamdulillah, I hope you guys, got the message, inshallah. Okay, so MIASA being a mental health advocacy and peer support group. So for your information, the majority of people in MIASA are people with lived experience. So either we are a peer, a person with the condition, or a caregiver, and the balance are mental health advocates. So it could be a mental health professional, it could be people from various professions or students. We have a lot of students that volunteer and become members of MIASA, alhamdulillah. I think it's very powerful in that sense because, half of all mental health conditions begin at the age of 14. So we really, really need input and insights from teens and youth. So I want to talk a little bit about peer support because truly peer support changes lives. So a little bit of history. Peer support actually, the whole advocacy of peer support started in the 1920s. But really, if you guys know Alcoholic Anonymous, they are the ones that paved way to peer support globally. And in 1999, peer support actually became evidence-based. So it has been about 22 years now, although in Malaysia, it's still very new. I'm also very happy seeing many universities and youth movements having peer support groups right now, alhamdulillah. Okay, I just wanted to share with you, this is actually an analogy that was introduced in 1999 by the US Department of Health and Human Services, Substance Abuse and Mental Health Administration in the US. So this is actually showing or portraying the power of peers, okay? So imagine that somebody falls in this deep hole, right? So just for storytelling sake, let's say the person's name is Dan. So Dan falls into this hole and, he can't get out from this hole. So one day, so his teacher passes by and he calls up to his teacher and says, Miss Jane, I'm in this hole. Can you please get me out? And Miss Jane said, Dan, I've taught you so many things in school. Why don't you try to use some of this knowledge and get yourself out? Can Dan get out from this hole? Of course he can. His doctor passes by and he calls up, Doc, I'm stuck in this rut. Can you please get me out? And his doctor gives him throws in this hole, antidepressants, antipsychotic medication, benzos. Can Dan get out from this hole? Of course he can. His counselor passes by and he calls up to his counselor, please, Miss Thomas, get me out from this hole. I'm stuck. And Miss Thomas says, remember, I taught you, CBT. Can you try and get yourself out? Implement that. Can Dan get out from this hole? Of course he can. Then Anita passes by and he hollers to Anita. He said, Anita, help me out. I'm stuck in this hole. And you know what Anita does? Anita jumps into this hole. Dan looks at Anita and says, Anita, why did you jump into this hole? Now we're both stuck. And Anita looks at Dan and says, my dear friend, I've been in this hole before and I can show you the way out. So this, my dear friends, is the power of peer support. And peer support, let me tell you, is evidence-based, as mentioned, and there are so many data, so much of research to show how powerful it is. And not only does it increases self-esteem and confidence, when we meet peers, people that have gone through the same condition as us, that has gone through the recovery process or still battling mental health disorders, you find an increased sense of hope. You find a way out. You feel empowered. You also find a lot of inspiration because there is, empathy, there's acceptance, there's, camaraderie, right? And, it's so interesting that it also reduces hospital admission rates. It decreases psychotic symptoms, and it also decreases substance abuse and also depression. So emerging research does show that peer support is effective for supporting recovery. And, I've gone to many countries. I've listened to so many evidences of peer support groups, where they build recovery colleges, where they build, clubhouses, 100% pure initiative with no, professionals in it, and how much of empowerment and recovery that has happened throughout such an initiative. So, hopefully, one day this can happen in Malaysia as well. And I wanted to share with you in 2019, obviously, this is, 2019 was the year, it's the most recent years on, of MIASA doing a lot of things, because 2020 was when the whole pandemic happened. So we weren't able to do a lot of, our physical programs, and a lot of things that we aspired to do were postponed, and we, went through the quantum leap, migrated all our services online, and, of course, we continue our services physically as well. But we went through that quantum leap, and we realized that now doing things online, we are able to reach more people. We are able to reach people that we weren't able to before, especially those in, rural areas, far in, via all these, different ways of doing things, either our social media, infographics, or, forums, workshops, programs, talks, and, online services, alhamdulillah. So coming back to the conference in 2019, what we really wanted to do was bringing that term of experts by experience, because usually when we talk about experts, especially in the field of mental health, obviously in this context that we're discussing today, we think about mental health professionals, right? So we think about psychiatrists, we think about psychologists, but when you step out of Malaysia, right, you will see that experts by experience is something that is so valuable in other countries. Peer support specialists are so valuable. They have it in clinical settings, they have it everywhere. And because of that, there's, it has translated in a lot of insights, understanding, and improvement in treatments and help. So this is one of the things that we really wanted to introduce to the nation. And what happened was, after we finished the Malaysia, the International Mental Health Recovery Conference, we initiated the Malaysia Stakeholder Meeting with the theme Inclusion is a Human Right in Mental Health. And these are the top 5 resolutions that were agreed upon by all the stakeholders. One, first, is to fight stigma and discrimination. 2, provide supported accommodation and the right to housing. So, for example, in Malaysia, if you declare, openly that you are a person with a mental health condition, you're not able to buy a house, purchase a house, for example. The right to work and employment. And I think many of you know a lot of people with mental health disorders are stigmatized in the workplace, which leads to then discrimination. And unfortunately, many are then, they are not able to sustain their jobs, then they are forced to leave. There are instances of people being terminated, unfortunately. So this is something that we very much champion and try to fight for. And of course, the right to healthcare. I think we all know this. If you have a mental health condition, you are not allowed, to purchase a medical insurance policy. Is a straight, forward exclusion in that sense. And the last one is to close down mental institutions. So just to give you an overview on the situation in Malaysia, and via this stakeholder meeting, what was agreed upon. So before I get into the topic, I just want to go through, some of the structural problems in Malaysia that exacerbates the situation. So first and foremost, we look at the National Health and Morbidity Survey. We have seen that there is a jump about threefold from 1996 to 2015. Today, 29.2% of people ages 16 years old and above having a certain mental health problem. And of course, the data now will show a tremendous increase, especially with the pandemic hit. And again, this is what we've seen throughout, pandemics, throughout epidemics, throughout financial crises, war, whatever, global crisis that, comes across, a lot of people will be affected psychologically. And of course, inadequate mental health system. So, people with mental health condition, we don't have laws that fully protect us. There's no mechanism. And so a lot of people that go through, this condition will be very much discriminated. The things that we say are questionable in that sense. And if we look based on data and research, a person that has this condition, they are more prone into being victims, right? Rather than the perpetrator. So there's so much evidence to show this as well. But obviously, because of the stigma, because of the negative perception of society, we believe, the flip. Lack of mental health financing. There's about 1+%, which is given to mental health, where 66% is given to mental institutions, or the four big psychiatric hospitals, which only houses about 1% of people with mental health condition. And so the 99% of our mental health peers that battle anxiety, depression, personality disorder, whatever that it might be in the community, they are undertreated. And then of course insufficient mental health services. I'm sure we all know this. In Malaysia we have only about 410 psychiatrists as of end of, I think, 2018. The numbers of registered psychiatrists, very, very low numbers of clinical psychologists as well. I think it's 200 plus. And of course, low numbers of counselors, social workers, what more, peer support or peers. And low mental health literacy, which, breeds high levels of stigma. So low mental health literacy in urban areas, what more in rural areas where accessibility to information is scarce, more scarce. And of course, at a global level, we're looking at, 300 million people are estimated to have depression, which is equivalent to 4.4% of the world's population. And a lot of people say, why is the conversation of depression very important? It is crucial, guys, because one of the symptoms of depression is suicidal thoughts and ideation. And so this is why this conversation is crucial, because, it can lead to someone giving up. And when you give up, your thought process is closed. And this is when, the intensity of, suicidal thoughts and ideation kicks in. And unfortunately, if the person, doesn't get help, or, is struggling alone or suffer in silence, then unfortunately, ending one's life, or, suicide might happen. So this is why this conversation is very important, because suicide should be everyone's business. It is preventable. Mental health condition is treatable. So this is the message that we want to get across. And depression is a major contributor to suicide death, which is about 800,000, every single year. And as we speak, being in this current pandemic of COVID-19, suicide, risks have increased, right? We don't have the numbers of suicide yet, suicide rates, but suicide risk definitely has increased, as what history has shown us. In Malaysia, 2.3%, which is 500,000 people, have depression. Very, very worrying number is 424,000 children were found to have mental health problems. And with all this crisis happening across the globe, this is going to be a huge number of children having, mental health condition, being, impacted psychologically. Okay, so now I want to go into the topic of stigma. In most parts of the world, issues related to mental health are not regarded with, the same importance as physical health. And I think we all know this, because if it was regarded the same, then it would be, easy for someone, for example, in the workplace to get an MC if they wanted to see a psychiatrist. Or, students, for example, in universities, there will be no shame in talking to your lecturers saying that, I need, a couple of days off, my mental health is not really quite there yet. But this is not the case. Currently, there's still a lot of shame, a lot of fear attached to mental health and mental health issues, and what more, mental health disorders. So hopefully, by normalizing this discussion, we can reduce stigma. So what is stigma? We talk about it all the time. What does it really mean? It's actually the negative perception of individuals. You might, you never meet a person with a mental health condition, or you don't even know a person with a mental health condition, but because of what people tell you, or from, the movies that you watch, or from, things that you read in books, for example, you then build this perception that a mental health, peer or person with a mental health condition is crazy. They're violent, they're dangerous, they're going to flip out, they can't work, they lack of faith, they're weak-willed, etc., etc. So it's very, very saddening because stigma really is an attribute that is deeply discrediting, because it will then, lead to uneducated opinions, which then will lead to myths. So there are a lot of myths when we talk about mental health disorders, which I will share with you here shortly. So how does stigma form? As mentioned, so from what your moms tell you, from what your grandma told you, from what you see in the movies, so stereotypes are then, it happens, right? So it's a widely held but fixed and oversimplified image or idea. So you think now that you have this certain perception, you've never interacted with a mental health peer, you don't know anyone, but you feel that they are, dangerous, right? So then you feel, I'm afraid of them, I don't want to be friends with them, I don't want to, marry them, I don't want to be, I don't want to work with them, I do not want to be neighbors with them, for example. So it goes on and on and on. And so this will then become stigma of the public. So it becomes a public stigma. And then, it continues. And so how do we break this, right? So this is actually a huge uphill battle. I always say it's so difficult. And, a lot of peers, always tell me things like, we really need to do something about it, really, really need to speak out about it. But then at the end of the day, a lot of people don't talk about it as well, because we internalize stigma, right? We feel embarrassed, we feel ashamed, we feel that if we reveal our identity, that people wouldn't want to be friends with us, people wouldn't want to work with us. And so it becomes this really vicious cycle. And so people that are ready to talk about it, I truly encourage you guys to join, NGOs like Miasa, so that we have a louder voice, so that we can push for this and we can reduce stigma as a whole, so that, no person is left behind. So the commonly held negative stereotypes are the following. Schizophrenia is the most highly stigmatized mental health condition. When you think about, when you see the word schizophrenia, or you listen, or watch movies, the first thing that comes to your mind automatically is, they're crazy, or they're violent, or they're dangerous, right? So it's a very highly stigmatized condition. And the other stereotypes are people are to be blamed for their mental health problems. They need to pull themselves together. They don't normally recover. So this is one of the things that I usually tell our peers, you've got to trust yourself in the process. And, I really hope that, caregivers, those that are helping, if you're helping your loved ones to go through that recovery process, you have to believe in the person. You have to believe that your loved ones can recover. If you don't believe them, then how can they believe themselves? Because, when you're in deep crisis, when you are struggling with a mental health condition, it is, hands down, guys, I can tell you, it is such, orang kata apa, a very challenging, it's excruciating pain. The struggle is real, and, it requires a lot of willpower, a lot of knowledge, effective coping mechanisms, treatment, support. There must be a holistic approach to it. Then can only the recovery process happen. And that is why caregivers play such a crucial role in the recovery of a person. Work colleagues, friends, your extended family members, what more, your close family members, to help you in this recovery process. And I will also share with you on how you can do this. One of the things that is very unfortunate as well in Malaysia and many Asian countries especially, is the misunderstanding due to cultural reasons, right? So many families, especially in the rural areas, still relate mental health problems with demon possession, divine punishment, sickness of the soul. So selalu kita dengar sihir, saka, jin dengan syaitan selalulah kena. So they're always blamed when people get a mental health condition, when it is a medical condition, right? So rather than being viewed as a scientifically proven disorder, it's viewed as a supernatural phenomenon. So we go and see, alhamdulillah, kalau yang betul, you go and see an ustaz or a spiritual healer, but there are people that, go to shamans, for example, bumu dan sebagainya. And inaccurate perception, I think Brother Anwar touched on this earlier, believe that only weak people succumb to mental health issues. And I really would like to highlight this point where, given enough factors, anyone can get a mental health disorder, right? So it doesn't mean if you're a clinical psychiatrist, you can't get a mental health condition. Doesn't mean if you're a medical doctor, you can't get a mental health condition. Doesn't mean if you're a lawyer, you can't get a mental health condition. Doesn't mean that you're a housewife, you can't get it. Or if you're old, or if you're not religious, or if you're religious. It's not about that. If you have enough factors, anyone can get a mental health condition. And one of the things based on research that they have found is that on a survey that was done, 50% of Malaysians believe that when it comes to mental health disorder, the sufferer is to be blamed for their condition, while about 80% believe that there is no such thing as a mental health problem. That this is so interesting. And this was actually done, it came out in the International Journal of Academic Research in 2019, so it's not far off, right? And of course, portrayal by the media. So this is very unfortunate. Media, they can play a huge role in combating stigma or in reinforcing stigma, right? So what we've seen, for many, many years, negative portrayals, inaccurate portrayals of people with mental health disorders. So usually a person with a condition, become murderers, or they're seen as violent or dangerous or crazy. So all these things can reinforce stigma. And, one of the things that I always say, being the media, we have to do our jobs responsibly, right? Do research, talk to people that have the condition, portray them accurately with the, depth of their condition. They go through so many things. It's very complex, but try to end it with a success story. Providing helplines, providing, people with mental health conditions, showing that, they can, lead happy lives, they can be successful, they can get PhDs, they can become doctors, for example, but we don't do that, right? Usually what is portrayed in the media, be it films, movies, dramas, music videos, it's always negative. And characters with mental health disorders are often depicted as, peculiar and of course dangerous. So this is what we've seen. And of course, this is where, this negative perception of the society stems from. A lot of it is through media. So what are the dangers of stigma? Why is this conversation of stigma so important? Well, obviously it is, because not only do peers, people with mental health condition, we internalize the stigma. And when we internalize the stigma, what does this mean? This means that we believe what their society believes as the truth, right? So now, we've already internalized the stigma. We feel embarrassed, we feel ashamed, we fear. There's a lot of fear. And then once we, believe what the society believes, then, it is difficult for us to reach out for the help. And then we end up struggling alone and struggling in silence. And then this is when, unfortunately, when it becomes very excruciating with no help, that, this is when suicide happens, right? So these are, of course, the dangers of stigma. And like I mentioned earlier, it is still the biggest barrier to mental health. It is a huge threat to self-esteem, barriers to seeking of help, and we taken the label as the truth, as mentioned. And of course, when we don't seek help, then it restricts ability to socialize. It reduces job ability, because a lot of people, we have this perception, okay, a person with a mental health condition is not fit to work. But then when a person internalizes the stigma because of the society's perception, then they don't seek for the help. And when they don't seek for the help, then they can't work. And then that will justify then, the society's perception. Then the society will say, see, I told you, a person with a mental health condition can't work. So it becomes that vicious cycle, guys. So how do we break that cycle? This is what really needs to happen. And I always say we need to come from a place of empathy. We need to come from a place of compassion. We need to come from a place where I probably don't know everything. You know, like what I said earlier, you know, we need to reframe, you know, our traditional way of thinking. Even mental health professionals, you know, maybe we should be thinking from a standpoint that, you know, we don't know everything, because knowing that you don't know is also knowledge. And of course, we need more, you know, peers, mental health peers being involved, right, in the planning, in the design, in the delivery and implementation of mental health services, you know, being in clinical settings, being in, you know, part of solutions where we talk about amendments of policies, for example, like how other countries do it. So if we do that, then of course we can get a more conclusive solution. More people will be able to get, you know, better help and better treatment in that sense. So this is actually a social conformity video. This is actually an absolutely awesome, you know, video to really show you how stigma built, right? This is actually quite a long video, so I will skip certain parts of it as we go along. I hope you guys don't mind.
Stop. Pay attention. Take a look at this crowded waiting room. These people may appear to be waiting for the eye doctor, but they're actually waiting for the first test subject in our hidden camera experiment. And here she is, right on time for her 12 o'clock appointment.
Hi, how are you doing?
This woman thinks she's here for a free eye exam.
Have you been here before? No, it's my first time.
What she doesn't know is that everyone else in this room is working for us.
They'll be with you in just
It's okay if you guys can't
Today
hear the
we're running
video,
an
just
experiment
watch
on
it,
social
okay?
conformity,
So
and the
everyone
test
in this
starts
video,
now.
they're all actors except for the Asian woman.
Did you hear that? These people sure did.
Okay, so when you hear the bell, then everyone stands up. So now she's just looking at everyone, and look what happens after
It
this.
doesn't take long for our test subject to notice a pattern. Beep means stand up. But why? And if you were in her shoes, what would you do the next time the tone sounds? While you might think you make your decisions all on your own, when it comes to peer pressure, all too often, your brain is just following the crowd. It's all around you, every day. An invisible force you're probably not even aware of. It affects what you do, how you think, and who you are. It's called social conformity, or peer pressure. And while it might not sound like a good thing, it's actually not so bad. The truth is, your brain craves synchronicity and takes comfort in the ease and efficiency of just going with the flow. And whether it's simply knowing what to wear in the morning, supporting your team at the big game, or even marching off to war, we're all programmed to be part of the group. And that's because your brain knows that there's power in numbers. We set up a hidden camera experiment to see if this woman would stand up at the sound of this tone, simply because everyone else is. You might be thinking you'd never go along with this. Or would you?
So eventually, after a couple of times,
After just 3
bang,
weeks,
now
and
she
without
stands
knowing
up.
why she's doing it, this
Doesn't
woman is
even know
now
why she's
conforming
doing it,
perfectly
but
to the
because
group.
everyone is doing it, so she does it as well.
But what happens if we take the group away?
Elaine, please.
And it's so interesting that when no one is there, you'll see what she does. So all of them are actors, right?
Okay, now she's alone. The crowd is gone and nobody is watching her except our hidden cameras. What do you think she'll do?
Oh my God, so sad.
She's now conforming to the rules of the group without them even
Peer pressure,
being
right,
there.
guys?
Now, watch what happens when we introduce another outsider who doesn't know the rules.
For a new appointment. Have a seat and they'll be out in just a couple minutes. Great, thanks so much.
So when they were doing this video, they were saying a lot of people are going to say, oh, she's Asian. Obviously, she's going to cave to peer pressure. So they introduced this other guy who obviously isn't Asian, and look what he does.
Why are you standing up? Everybody was doing it, so I thought I was supposed to.
Think she'll teach the new guy what to do?
See? So this is what it is, guys. This is how it builds, right? Peer
We
pressure.
kept the cameras rolling as more
And you guys can watch
unsuspecting
this
patients
video, but this
arrived.
is really what happens throughout this video. Okay, so I wanted to show you another one on stigma. These are people that have gone through it. And I think it's a really good video, so I'll just play it.
To me, stigma is my boss telling me that I looked fine. I felt guilty that I didn't have any visible signs to prove the pain and suffering that I was going through.
To me, stigma is people who tell me that I don't look like the sort of person who has depression because I go out with my friends and I work really hard and I smile a lot. The truth is that I can suffer without having to have my head clutched like this all the time or cry all the time. The struggle is real, and it's important to realise that you can't necessarily see a mental illness.
Hi, I'm Ollie Regan, and stigma to me is in a relationship when you're with a partner and they just tell you to sort yourself out, there's nothing wrong with you, just man up. I think manning up is what is has been the biggest stigma with me, and it's sort of made me not want to show emotions, not want to tell people how I feel, and be the person that I need to be. So that's the stigma that I've faced, and it's changed my life and stopped me doing certain things.
To me, stigma is being accused of being lazy at work when I was struggling to cope. It made me feel horrible that they would feel that, and made me worried that my other colleagues would feel that I was exaggerating my illness to get out of working hard.
I remember going back to university after a major psychotic episode, and what really struck me was just the silence. If I'd had a back brace or a broken leg, people would probably have said, well, what happened and how are you doing now? The silence really made me feel more ashamed and more isolated. And I remember about a year after I got back, this guy just asking me in conversation why I'd taken a year out, and what that meant. And it was like this huge weight off my back. And from then, it was much, much easier for me to talk, and much, much easier for me to come to terms with what had happened. Always be the person to ask that question, how are you doing?
All right. Okay, so I want to talk a little bit about improving community attitudes. What can we do? Obviously, increasing awareness, talking about it in education, of course, changes everything. Knowledge is transformative, and this is what we're trying to do. And stopping constant reinforcement by media. So I think this is very important, although there are guidelines available. And as much as possible, we do from time to time share these guidelines. But I guess, being the media, they have KPIs to achieve as well. And I've seen improvements this couple of weeks. It was so interesting reading, some of the headlines, and, it said something like, a person fell. And I was like, oh, at first I didn't realize that, okay, is this suicide reporting or what is it about? But then I realized that they are now, the media has now understood these guidelines, and they are now using the word, fell rather than jump, right? Because jump is unsafe. And so words really matter. And so this is what we, are trying to educate the media as much as possible as well. Okay, so as promised, I wanted to share with you some of the top, stigma that exist in Malaysia, and of course globally as well. So people with, the condition, they're crazy, they're dangerous and violent, lazy and use it as an excuse, are not fit to work and be productive, and are not able to make decisions and take care of themselves. And I think this is what continues to happen, when we talk about, mental illness or a mental health disorder, the first thing that crosses our mind usually is automatically is the person is crazy, right? Or the person is dangerous and violent. And this is very, very common. And, as mentioned, is because of, media portrayals, public stigma that then becomes, part of our own belief system. But in actual fact, let me tell you, the people that we see on the streets, for example, the homeless folks, right? Many of them we typically would say, they're crazy. Let me tell you, many of them are people with a mental health condition, but these disorders are not treated. So this is why you would see them, talking to themselves, for example. If you take these people, the majority of these homeless folks, you bring them to the hospitals, get them treatment, get them medication, support them, provide them jobs. Let me tell you, they are able to lead normal lives like all of you. So these are some of the things that we don't think of, right? So and mental illness patients are dangerous and violent. Let me tell you, it's less than 5%. A normal person being dangerous and violent, it has, it's the same. A normal person being dangerous and violent, or a person with a mental health condition being dangerous and violent, there's no difference really. It's like saying, if you have a physical condition, you are more prone being dangerous and violent. That doesn't make sense, right? But it makes sense when it's a person with a mental health condition. This is what we believe, right? So this is the sad truth about it. And another thing that we don't think about, of course, is also substance abuse, right? Obviously, when a person does substance, especially drugs, then of course they are going to possibly be more dangerous and violent. But in many tragedies, in many cases, reports that happen, we would usually blame it to the person has a mental health condition without really understanding that drugs were involved in the first place. A person with a mental health condition is not fit to work and be productive. Obviously, if a person has a certain condition, they would need to get help and treatment. They would need time out. But because being employers, let's say due to lack of knowledge, you don't really understand it, you wouldn't allow, you would stigmatize the person that has a mental health condition, and you would not validate what they're going through, what more approving this MC of 2 months, for example. But if a person comes with an MC because of a physical condition, or going into an accident, for example, you would say, okay, please rest, don't worry about your job, somebody else can do it for you, and then you can come back, take all the rest that you need, get yourself better, etc., etc. So this really is what happens on the ground, unfortunately. And hopefully through all these education awareness campaigns, that we're able to do more things in the workplace, and employees are able to understand better. So that's why one of the initiatives that we have done at MIASA is providing a program called supported employment. Because people with mental health condition, find it challenging to sustain, their jobs, in an open competitive environment if their employees don't understand it. So we work with employers, we provide psychoeducation. So it will be a win-win situation in that sense. So we support our peers. We help them to get their jobs in, an open, competitive environment, whatever that they're passionate of, interested in, but it has to be a job fit. And then work with employers to ensure that they understand what's happening, the situation of the mental health peer, and then that way it will be a win-win situation for both the employer and the peer as well. And of course, again, not able to make decision and take care of themselves, need to get the treatment, get the help, fully supporting the person. Inshallah, they will be able to return to the workplace and take care of themselves and be independent and lead quality lives. So how does stigma affect those with mental health disorders? And obviously, they're afraid of being labeled as crazy. They then feel ashamed to seek help and support. Then they will withdraw from society. They will struggle alone and in silence. They feel crippled. Then they forget, about their strength and then the capabilities. Like I mentioned, it really kills self-esteem, right? Then they would believe that recovery isn't possible. They can't see a way out. They feel that there's no hope, there's no light at the end of the tunnel. Then they lose, meaning and purpose in life. And a lot of people, are defined by their careers, right? I think a lot of us know this. And so imagine having the condition, being stigmatized, discriminated, losing their jobs. What is it in for them? That is why recovery then seems so impossible. And then you lose, that meaning and purpose in life. So people give up, and so this is unfortunately how then one decides to end their lives, unfortunately, which is very, very, very sad when suicide is really preventable. So what can we do as a society? Don't be quick to judge, guys. Seek knowledge. Don't advise but suggest. We want to be listening to understand, and not listening to advice. And you've got to be really, really patient when you are helping a person with this condition. Don't give up. Try to build understanding, come from a place of empathy and compassion, provide positive comments. And I think what is most important is to let the person know that you're there. It doesn't mean that you have to be there for them every day, but you can check up on them, tell them that you're there, just a phone call away. That you're there if they want to WhatsApp you, for example. So just letting the person know that you are there really is a huge help, right? Because it can determine whether a person wants to live or not, right? Okay, so what are some of the ways to destigmatize mental health? So as mentioned, peer inclusion is very, very important. Having people with lived experience involved in the design delivery of mental services in anti-stigma campaigns, very important. Contact-based education, as I mentioned earlier. So those that have especially stigmatizing attitudes towards people with mental health condition, they should be interacting with people with the condition so that they know, oh, wait a minute, person with a mental health condition, really they can work, they can lead quality lives, they can recover. So it's really important in order to reduce stigma is to be in contact or have contact with a person with the condition. And of course, I think one of the bigger challenges is always, even if you have a change in perception, whether it would translate into change in behavior. So for example, you guys attending this talk today, now you have more knowledge about mental health. Now you have more knowledge about mental health disorders, but whether leaving this session, you will do something about it. So that remains to be seen, actually. And of course, more research is needed to better understanding how stigma affects help-seeking. Working with the media definitely is so important. There's no one size fits all. So when we do awareness programs, when we do workshops, it has to be tailor-made to the audience. And of course, prejudice and discrimination are prevalent within the health system and must be recognized, because these are the people that are supposed to be of help to people that are struggling. So if there are, stigmatizing attitudes or prejudices that exist, we must recognize this so that something can be done about it, right? And building a stigma-free generation, of course, having youth involved, very important. And of course, work opportunities for people with lived experience must be fostered, and it's very important to capitalize on the workplace for anti-stigma intervention, because many people work, and so that would be the place to really carry out, anti-stigma campaigns, awareness programs. And it is important to adopt a human rights and social justice framework to bring about structural changes and support. And let me tell you, it is so important, to change the way that we think. When we talk about human rights-based approach, let me tell you, it has, revolutionized the way, we think, because when we treat a person, as a human being, it will change the way we think, it will change the way we do things. It will change the way we behave or treat the person. So this is really, really important. So we really need to understand that, the person isn't the illness, isn't the condition. They're human beings that have gone through, traumas in life, that have gone through, maybe during this pandemic, loss of loved ones, they're going through grief, they're going through financial problems. So there's so much of underlying issues that must be addressed. And if that is done, then obviously, we can all recover from this condition, inshallah. So making a declaration, what is one thing you can do to tackle the stigma of mental health problems? So we want to go back and think about this, right? I know I don't have much time. Just a little bit on discrimination. So discrimination is when someone treats a person with a mental health disorder in a negative way. So usually when there's stigma, it will then lead to discrimination. And so, we see this, regularly. A lot of our peers, always tells us that they get discriminated, be it, in the workplace setting, in, the education setting, even in hospitals, in their own homes as well, unfortunately. And so, the the forms of discrimination, so here it is, as mentioned, healthcare settings, education, employment, housing, and of course in choices as well. A little bit about social inclusion. So this is so important when we talk about the impact of stigma, discrimination. What is social inclusion? So we want mental health peers to be included, right, to feel accepted, being able to participate in the community, as equal, on an equal basis. And this is what we're not seeing currently. So people being diagnosed with a mental health condition can, as I mentioned, enter a vicious cycle of social isolation, because this diagnosis, let me tell you guys, it can be very alienating. People don't want to be friends with you. They're scared of you. They feel that you're going to flip out, or they don't want to work with you because they think you're not going to be able to perform. You're not productive in that sense. So we really need to work on inclusion. And this is what, at Miyasa, we try to do as much as possible. The theme of inclusion, we've done it twice during our press conferences, for World Mental Health Day. And so social inclusion helps to address stigma, prejudice, and discrimination by contributing to education. So we, address ignorance, deals with those who hold, of course, negative attitudes, and identifying and addressing discriminatory behavior. So we want to go back and really think about it. Do we, stigmatize people with mental health conditions? Someone comes to you and says, I'm suicidal, or I'm going through depression. Would we, want to marry them? Would we want to be friends with them? Would we welcome them with open arms to be part of our study group, for example? So let's really think about this. Okay, I think this is about mental health, and you guys know about this, just about taking care of your mental health. Although we know this, we don't necessarily invest in this. So I just want to show this, and I will end here. Please take care of your mental health. Have a sleep routine. Have enough sleep. Eat well and on time. Exercising is really, really helpful. And I know all of you know this, but please really invest your time in it, especially, when this lockdown happens. And of course, invest in hobbies. I say this so much to everyone. We really need to invest in hobbies, guys. Do things that you like. This is so important. Volunteering work, oh my god, it gives you so much of intrinsic value. Induces so much of good hormones. This is so important. There's a feel good factor, obviously. Giving to charity, spiritual classes are so important, no matter what religion you are, because really understanding the reason behind you having, or God inflicting you with this condition, is so important. What are the lessons that God is trying to teach you? What are the lessons that you can take away and then share it across to other people, so that they don't have to struggle like you do, for example. And of course, social connectedness is so important, especially being in the pandemic of COVID-19. Being in a lockdown, you're going to feel very lonely, isolated, and very disconnected. So one of the ways that to remove that feeling is to connect with your family members, with friends, video call them more often. You're able to reach long lost friends, for example, your friends that have gone overseas. This is the time for you to really catch up. And I think through connectedness in this way, it would really help being in this pandemic COVID-19. And I think the other thing that I would really recommend, especially for students, is to have a schedule, to have a routine, plan ahead. I think this is very important, because it would help you to declutter as well your mind. But again, do not be so rigid about it. Okay, so these are some helpful tools, I believe. Okay, so these are some infographics that we have prepared for those of you that want to know where and how can you get help, because this continues to be our FAQ. And of course, from either the government sector or non-government sector? How can you find help for mental health issues? And what do we need to do when we encounter people who need support? So obviously, seek knowledge, encourage treatment, build trust, listen to understand, and provide emotional support, telling the person that, you're there, and, don't judge, don't label, just listen to understand. So I think that is all, guys. Thank you so much. And thank you so much for listening.
Alhamdulillah, thank you so much to Puan Anita Abu Bakar for the inspiring talk just now. Dear audiences, we will now move on to the Q&A session. If you have any questions to be asked to the speaker, you may open your mic to us, or you can just type in your questions in the chat box provided. But before that, we have one question from YouTube, from Zul Marksi. He asked, is it difficult to find jobs if we are clinically registered as having mental illness in Malaysia?
Yes, unfortunately, it is going to be challenging if you, disclose openly that you have the condition. Although, I would recommend disclosing, because if we do not disclose, then, the stigma never ends, really. And if you choose not to disclose, you can go ahead and do that. But what is important, continue your treatment, continue having that support, continue to get the help that you need. So the truth is, yes, it can be challenging to get a job, but there are employers that don't mind at all, and there are employees that tell us they would rather have a person with a mental health condition working, because people like us really value the opportunities given to us, and so we will give our all to ensure that we're we do the best that we can, and sustain the jobs. Alhamdulillah.
All right, thank you, Puan Anita. Is there any questions from the floor? Okay, another question from Ash. She asked, what should we do to our friend who suffered mental illness that we already advised him or her to seek for help, but still do not want to do so?
Okay, I think this is very common, to be honest. Please do not give up. Please continue to be there for your friend, and slowly you can revisit that suggestion of encouraging the person to seek for treatment. I hope that you are patient with your friend, because really it takes a special person to help, and not everyone helps. So it's not something easy. Benda tu pun adalah jihad sebenarnya. So I hope we all understand this. If we want to help a person, then we have to be extremely patient as well.
All right, next question. What can a mental illness sufferers themselves do to help ending the stigma in the community?
I think there's much that you can do. The easiest thing is to educate people surrounding you, right? It can be your family members, it can be your close friends. So this is one of the ways. And then the other way that you can do, which is within your capacity as well, is to speak out when you see someone discriminating a person with a mental health condition, or stigmatizing a person with mental health condition, or saying things like, aku tengok dia tu pelik lah. I think he's crazy, for example, or something's not right with him. He just walked out from the counselor's room. So if you hear things such as that, please, I beg you, do not ignore. Say something about it. That is the only way, guys, and it is within your reach. So please do that if you can. So those are really two big things. Let me tell you, if everyone does that, tomorrow there will be no more stigma in Malaysia.
All right, thank you. I think Brother Anwar have two questions to be asked.
All right, thank you, Sister MC. I would like to use verbal questions. So there are two questions actually to Puan Anita. First of all, thank you very much, Madam Anita, for the sharing. I think it also opens up my mind, because even in my field, biomedical science, we are taught about the psychology, neurology, even how the anatomy of brains. But to understand it, it takes more than thick books and journals to understand the people. So I
People
have to,
don't fully understand it till today.
yes, sadly, Madam Anita, but I think
Yes,
it is always work in progress.
it
I
is.
think.
It is. Alhamdulillah.
Alhamdulillah, inshallah. So I have two questions. The first one might be quite technical. Can I have your permission to have your slides after this sharing session?
Of
That's
course
the
you can.
Thank you very much. And here goes the second one, which is I'm actually interested. If let's say the students are interested, which I am very interested to join the advocacy or the team of MIASA after this, especially because I'm a graduating student. So how can we actually, especially the university students, can participate in MIASA? Thank you very much.
All right. Thank you very much, Brother Anwar. Okay, so if you want to be volunteers, we have about 900 volunteers nationwide, and we really welcome students that want to volunteer or come for internships or to do community projects, for example. So you can register as part of our volunteer team via our website, which is www.miasa.org.my. So register yourself there, and then we will put you in the team. You know, you can choose. We've got, you know, our marketing team, research team, we've got our crisis team. So if you are a person that really wants to help and is more proactive, then you might want to join our crisis team. Our crisis team works 7 days a week, 12 hours a day, to help people that are in crisis. Yep. So I really encourage, you know, all of you, if you, you know, want to make a difference, if you're keen in making a change, becoming agents of change, please do come and join MIASA, you know, to do this advocacy and awareness, inshallah.
Thank you, Madam.
Thank you.
All right, the next question is, how do I know if I am unwell?
Okay. To be quite honest, we will know, especially if we have a mental health disorder, because you see the difference between a mental health issue, a mental health disorder, is if you have mental health issues. A lot of people have mental health issues, especially during the first MCO, right? So you have probably sleep disturbances, or you're not eating well, you know, you feel irritable, etc., etc. But how do you know if you have a mental health condition? You have to fulfill the minimum requirements. So let's say depression. There's 9 symptoms to depression. You have to fulfill a minimum of 5. And then you also have to fulfill a minimum time. So a minimum of 2 weeks, minimum of 5 symptoms, then you may possibly have a mental health condition. It will disrupt your daily function. That means you're not able to function as normal on a daily basis for a minimum of 2 weeks. Then you know that something is not right with you. So I can give you a very good example, since I'm, you know, speaking today, is how I, you know, found out that I wasn't well was, you know, when I thought back about, you know, my life, about what I was going through. I actually had so many signs, but because I didn't have the knowledge about it, that what happened was it took me frequent panic attacks to happen, and finally the last panic attack that I got 8 years ago left me crippled, right? I lost functionality in life. I wasn't able to function as a normal human being. You know, during the time I couldn't, you know, I couldn't be alone, I couldn't, you know, talk to anyone else, I couldn't drive, I couldn't be alone, I couldn't cook, I couldn't work, you know, I couldn't take care of my kids, I couldn't take care of the house, you know, so I lost functionality in life. So you really, guys, let me tell you, take it from me, do not wait when it gets there. Okay, it's really, really unfortunate, because, you know, even at MIASA, many of the phone calls that we get, the messages that we get from teens, from youth, they are already at an extremely severe, you know, part in the journey, because, you know, they come with, you know, suicidal, you know, thoughts. They come in with self-harming behaviors already. They come in with, you know, having regular panic attacks. So this is not, of course we would, you know, pretty much help you, but we would love to get people that, you know, just have mental health issues. So we need to be talking about prevention. We need to be talking about, you know, if you have mental health issues, what do you do about it? So this is what I can share. Yep.
All right, thank you. Another question from Aina Arisha. How can I help a friend who is experiencing breakdown and telling me her problems? And she directly told me I'm not being helpful in this kind of situation. How should I help maybe in the next time?
Okay, so if she says that to you, then just don't take it personally. Please don't take it personally. The person is going through, in crisis, going through a lot of distress. The next time, if she reaches out to you, or if you can, please do reach out to her and just listen. Just listen to her. Really, you don't have to say anything. You can say things like, I'm here whenever you're ready to talk, right? So just be there to listen, just to be there. You can just be silent. That's also okay, as long as you're there. And then when you see your friend, when she's a little better, then ask her, if you go through the same situation again, what would be more helpful for me to say, for example. So ask, don't be afraid to ask. They can tell you, we're normal human beings. We can think well. But just because when we're in crisis, when we're going through, when we're in a bad place, our mental health state isn't quite there, then we can be, probably sensitive or, angry, depending on what the triggers might be at the moment. Yeah. Don't take it personally as well.
Right, I think this is the last question. How do I deal with someone who keeps on telling me what to do?
Oh, okay, that's a very vague question. Is it your mom? Because then that's okay. Or who is that? Is that a friend telling you what to do? What does that mean? I think very difficult to answer. If I can have more details, then I can probably answer better.
Is there any question from the floor? All right, another two question. Does exercising help control mental illness just by itself? And another one, are there any ethnic or racial groups that are more likely to have mental illnesses?
Exercising definitely is very important because it calms the nerves, induces good hormones. Of course, it's very helpful, but exercise in itself doesn't work. I mean, it's not enough. Not that it doesn't work, it's not enough, obviously, because if it was enough, then we can all recover well just by exercising, right? So please do exercise minimum 3 times a week, but it's not enough to manage the condition, but it is very helpful in managing it. Ethnic racial groups that are more likely to have mental illness, and no, of course not. Like I said, is multifactorial. There's many factors that can contribute to a person getting a mental health condition. So doesn't matter what race, what religion, what your social status is, what your profession is. As long as you have the factors, you are prone to getting a mental health condition. A lot, I think more FAQs would be something like, my mom has a mental health condition. Does that mean that I will get a mental health condition too? Of course, if your mom has it, then genetic wise, you can't inherit a mental health condition, but you are obviously more susceptible in getting a mental health condition if you do not take care of your mental health, and also in combination with other factors. I think it's the same for any condition as well. So yeah.
Next question from Anna Farhana. Gaining more friends or keep in touch with friends might be easy as we will connected with our phones. Yet we also easily losing friends, which might trigger more during this pandemic. So how to deal with these unfortunate things?
Okay. I don't really understand why it would be easier to lose friends, unless you're talking about if it gets lost in translation, which happens a lot. So for example, you are, WhatsApping your friends. Some things might, you might intend to say something else, and your friend might, think you're saying something else. So I think it gets lost in translation that way as well. I don't really know about losing friends via phone though. I think this would be more of a friend issue problem.
All right, so next question. For those who do not have the ability to see a specialist in mental health, what can be done for those who feel they have symptoms of mental health conditions?
Talk to someone, very, very important. Talking to someone can ease the burden that you're feeling with your mental health struggles. But of course, it is crucial for you to do a mental health assessment or see a mental health specialist, because a clinical psychologist or a clinical psychiatrist, they're the only people that can diagnose you with a mental health condition. And obviously, if you get, treatment early, your prognosis is going to be much better, and this is what we want, right? And even if you go and see a specialist and you end up not, having a mental health condition, that's okay. At least you know. And obviously, if you think something is not right with you, you probably, are going through a mental health struggle. And it's very common for everyone to go through a mental health struggle once in a while, right? It's very important for you to know what to do if you indeed are going through that, because a mental health struggle, again, if you don't do something about it, and if there's enough factors, it can lead you to get a mental health condition. And again, take it from me, you don't want to have a mental health condition. It's very, very hard, guys. It's the hardest thing that I have ever experienced. And, crossing over to recovery is the second hardest thing. So please, as much as possible, if you do not have a mental health condition yet, please do something about it if you're going through, a mental health struggle right now. So take care of yourself, especially students. I know, you guys are doing online classes. Probably there's going to be screen fatigue. When you're done with classes, you got to do your assignments, etc., etc. But please, pace yourself. Take a break. Don't sleep at 2 in the morning. It's okay. Sleep at 11. Wake up tomorrow at 5. Get your rest. Do what you can. Right? This is a pandemic. This is history. This is not something normal. So just do what you can. Take care of your mental health. Take care of your physical health.
Right, thank you, Pak Anita. I think this is the last question from Nur Amira. Is it okay to hide our mental health problems from family members?
Oh, I wish we don't. I really recommend not doing this, but I also understand why you would want to do this. Families, family members are the closest being to us. They should be our support system. And sometimes I know families can be our triggers as well. But, I'm a mom, I have children, we as parents, we may not be perfect, but we want the best for our children. Have an open conversation, talk about it, right? Try to understand each other. I think we need to provide, opportunities and space. This is so important. So have this conversation as much as possible. Please do not hide it. I think being a mom, if I were to know that my child hid it from me, I would be devastated, because I would do anything, in my power to ensure that, my child recovers from it. So yeah, that would be my advice.
All right, I think that's all for today's Q&A session. Again, thank you so much to Puan Anita for the fruitful and engaging session just now. We hope that the participants can use the knowledge to prepare themselves better in the future. A friendly reminder to all participants, please be informed to fill in the attendance form and also the evaluation forms given in the comment section. We appreciate your help in evaluating this program, and there will be 2 evaluation forms that need to be filled. Okay. So, ladies and gentlemen, moving on, here comes the moment that we have been waiting for, which is the announcement for the winner of the competitions that were conducted during the program. But beforehand, please allow me to update the total donation, including fundraise for this program. All right, so the total would be RM 384 ringgit and 384 ringgit and 80 cents. Thank you so much to all donators. Now, let's start with the announcement of winners. The first competition conducted was Creative Writing and Arts Contest, A Story to be Told. The third winner is Sister Siti Atira binti Salmin with the title, Do You Know What Anxiety Feels Like? Second winner is Sister Sadia Tasnim Sristi with the title, Bubbles. And the first winner is Sister Nik Nur Alia binti Abdul Aziz with the title, Insomnia. Next, we move on to the video competition with the theme Lens of Truth. The third winner is Brother Ahmad Shakir Zufairi bin Muhammad Halimi with the title Call of the Void. The second winner is Sister Auni binti Muhammad Azam with the title Into the Soul of Survivor. And the champion of this video contest is, I think we have slide, yes. So it's from Sister Nur Afifa binti Asri and Isma Zaida binti Ismail with the title Am I Depressed or Just Lazy? Okay, congratulations again to all winners. With the end of the announcement just now, it marks the end of our ceremony for today. Thank you to all participants for joining us throughout this program. We hope that the participants can benefit from this program. But before we end, let's have some photography session for kids. I would like to invite all of you to open your camera for the photography session. Papro.
All right, we would like to request everyone to open their front camera. Time will be given. All right. Okay, is everyone ready?
Yes.
All right. On the count of 3. 1, 2, 3. Okay. Another one. 1, 2, 3. Freestyle. Another freestyle. 1, 2, 3. All right.
All right, thank you, Papro Committee. Ladies and gentlemen, we have now reached to the end of our event. From the bottom of our heart, we would like to thank all of you for spending your time with us. And on behalf of the organizing committees, I would like to apologize for any shortcomings that happened throughout this event. By the grace of Allah Subhanahu wa Ta'ala, let us end this event with the recitation of Surah Al-As and Tasbih Kafarah. Thank you for your support and cooperation. Till next time. Bye.
Bye.
Bye. Thank you so much, everyone.